Good afternoon, everybody. My name is Bessie Malila. I'm a postdoctoral research fellow at the University of Cape Town. Firstly, I would like to thank the organizers of this event for allowing me an opportunity to present our ongoing research in security for telehealth systems. The title of my presentation today is A Robust and Secure 5G-based Telehealth System for Rural and Underserved Communities. There is a global need for adoption of digital health technologies to strengthen healthcare systems. Current healthcare delivery systems are unsustainable. For example, healthcare expenditure and long-term care in OECD countries is currently 6% of GDP and expected to reach 14% by 2060. According to a World Health Organization report, the global shortage of healthcare workers currently stands at 17.4 million, which will be 9.9 million by 2030. In April 2019, the World Health Global Strategy on Digital Health was launched, and its aim was to accelerate the adoption of appropriate digital health tools that can be used to strengthen healthcare systems. Focusing on Germany and South Africa, the countries have different healthcare challenges. Germany has increasing healthcare budget due to rise in the aging population and expensive treatment options. The country has a high risk of closure of rural doctors' practices and this is expected to increase the pressure on urban healthcare facilities. South Africa's healthcare challenges include shortage of human resources, especially in rural and underserved communities, increased litigation against government due to avoidable errors, and shortage of medical equipment resources and poor record keeping. There is potential for improved healthcare delivery in Germany and South Africa. Digital health leads to decreased demand for healthcare services due to avoidable duplicate examinations, preventable hospital admissions, and improved treatment quality, resulting in minimized subsequent treatments. To date, cost savings due to digitization of healthcare in Germany is approaching 34 billion euro and is being driven by efficient gains and reductions in demand for healthcare services. Furthermore, savings in value through use of digital health services are expected to reach 64 billion euro. According to the South African National Digital Health Strategy report, digital health could curb long-term healthcare costs, enable better healthcare outcomes, empower both the patient and the healthcare provider, and enable introduction of new contributors to the healthcare ecosystem. 5G will drive increased adoption of telehealth systems, but security and privacy issues need to be addressed. The key drivers for enablers for 5G include enhanced mobile broadband, massive machine type communications, and ultra reliable and low latency communications. Furthermore, small cell technologies are expected to reduce the cost of deployment, especially in rural areas. 5G-enabled telehealth systems will enable increased network coverage for universal health coverage and adoption of new services and applications such as telesurgery and augmented reality. Evidence of security breaches in telehealth systems are abound. However, governments are implementing measures to address security and privacy concerns in telehealth systems. News of hackers stealing millions of medical records and selling them on the dark web, as well as billions of medical records being accessed online due to negligence, are all available now. Security requirements for telehealth systems include confidentiality, integrity, availability, authentication, and authorization. Violation of such requirements can lead to criminal use of patient medical data, discrimination of patients based on knowledge of patients' health conditions, and integrity of data. Violation of data integrity can lead to misdiagnosis, mistreatment, and patient death. And delayed access to medical information can result in delayed treatment, compromising patient health. There is therefore a need to develop new security frameworks that address emerging security risks to data in telehealth systems. The aim of this project is therefore to design, implement, and validate a 5G-based telehealth systems, which is secured using X-road and blockchain technologies and leverages on the security strengths of 5G systems. In our ongoing research, we try to answer the following questions. Firstly, can 5G small cell technologies be cost-effectively deployed to improve healthcare coverage in rural and remote areas? Secondly, what are the similarities and differences between X-ray and blockchain technologies when used to securely transmit and store health information? Lastly, what are the requirements, processes, and procedures required for implementing X-ray instances and blockchain and 5G based telehealth systems? We have proposed an architecture for a 5G-based telehealth system in our previous work, which consists of a data acquisition domain and mobile access network based on small cell technologies, a 5G core network, data storage processing domain for different healthcare providers, and a data retrieval domain for healthcare professionals. 5G networks have increased security risks due to the large number of deployed IoT devices, the open nature of wireless systems, and elevated use of virtualization and cloud services, which is resulting in a broader multifaceted security attack surface. We also studied similarities between differences between X-ray and blockchain architectures. And the one thing standing out between the two architectures is that X-ray is has got a central architecture, but the security nodes are distributed. Blockchain architecture is interconnected nodes, and the architecture is distributed and decentralized. There are also other similarities and differences between the two technologies. For example, all nodes in the blockchain are equal, whereas in the X-ray architecture, the central server controls the security servers. And an X-ray instance will consist of one central server and several security servers. Another similarity between the two technologies is that they both use cryptographic hash functions, but the difference in the use of the functions is that in blockchain, information stored on the blocks stored on the databases are linked together. Each message is linked together using cryptographic hash functions, whereas X-ray technology links groups of messages together using the hash functions. X-ray and blockchain could complement each other to provide end-to-end security in 5G-based telehealth systems. Both technologies have a successful history in securing distributed information systems. For example, X-ray in Estonia e-government system and blockchain in cryptocurrencies. Telehealth systems have similar architectures and can leverage on the strengths of both blockchain and X-ray technologies. As complementary technologies, X-ray focuses on securing information while in transit, whereas blockchain focuses on securing information while at rest, that is in storage servers. The limitations of blockchain include endpoint vulnerabilities, use of public and private keys, vendor risks, where device security is left to vendors. And blockchain technology is not yet fully tested, especially applications in telehealth. Applications are still at experimental stages. Limitations of X-ray technology include inability to guarantee security in endpoint information systems and the reliance of the architecture on the central server. We have proposed a security framework for telehealth systems based on X-ray, blockchain, and 5G security features, each node in the telehealth system being part of the blockchain network, including the X-ray systems. The system basically consists of a remote healthcare center or home environment, a communication network infrastructure based on 5G, on which X-ray environment is overlaid to provide additional security, and a home a hospital environment which allows healthcare professionals to access health data and provide treatment options. The proposed security framework leverages on the strengths of X-Road blockchain and 5G security architectures. 5G security features utilized in the framework include network slicing, increased network virtualization, device-specific security updates, and the requirement for establishment of trust between sender and receiver on an end-to-end basis. Utilization of X-Road security features include secure transfer of data between health information systems and blockchain nodes. Utilized blockchain security features include secure transfer of data between health information systems. The central server and security server also form part of the blockchain private network, providing an additional layer of data encryption on the system. We have implemented X-Road virtual and physical environments at the Anat University and with similar implementations underway at the University of Cape Town. The goal is to create a prototype of federated X-Road environment between Germany and South Africa. Following is a description of the implementation of the virtual and physical environments. Implementation details can be shared upon a request. Basically, the implementation steps used in the virtual and physical environment implementation are based on the information that is freely available on the X-Road documentation databases. And we also had assistance from the researchers working on the NIST project. So the second stage of the project involves implementation of private blockchain, which can be integrated onto the security framework. This is our ongoing work. The proposed private blockchain network is based on the Ethereum platform, and we are busy building the private blockchain network using the software modules recommended under the Ethereum virtual platform. We are also developing smart contracts which can be used as templates for telehealth systems. The last stage of the project is to integrate X-Road and blockchain onto a 5G test bed with network slicing feature implemented on the 5G system. The 5G testbed is implemented in collaboration with the Department of Telecommunications at the University of Cape Town. In conclusion, healthcare delivery challenges are affecting both developed and developing countries. Digital health has the potential to reduce healthcare costs and increase coverage to rural and marginalized communities. We have proposed a security architecture which leverages on the strengths of X-Road and blockchain and new security features in 5G systems for enabling secure delivery of telehealth services. Successful implementation of the proposed framework will promote scalable adoption of telehealth services, hence bring down the cost of healthcare delivery and help countries achieve the UN SDG goal number 3 of ensuring healthy lives for all at all ages by 2030. Thank you very much for listening to my presentation. Lastly, I would like to acknowledge the National Research Foundation of South Africa for supporting this research project. Thank you again.
Thank you very much for that very interesting presentation, Bessie. Now, also on the line there, we've got Samuel. Samuel Chinedu, are you there, Samuel?
Hello, yes, I'm here.
Hi, is it just you joining us or Bessie is also coming into the chat?
I'm also on the chat.
Oh, there you are. Hello, nice to see you again. Great.
Hi.
We've got both of you there. Okay. Very interesting insight into how you are combining X-Road and blockchain. And I know a few people are already asking in the questions here because I feel a lot of people are like, they still are not sure, why does blockchain need to be there? In your particular circumstance, can you explain again what advantage blockchain is giving in your security solution?
In our studies of X-Road technology, we observed that X-Road will protect information while being transferred between different information systems or databases.
Mm-hmm.
But before that instance, before the security server, the X-Road assumes that the IT system is responsible for the security of the system connecting onto the security server. So that's one limitation we noticed in blockchain. So that's why we thought we could introduce, so that's the limitation we saw in X-Road. So that's why we introduced blockchain to start right from the beginning of the communication, because for digital health systems, communication starts with data acquisition on the patient. And then there is a local area network or a body area network where the information is transferred between devices, and X-Road is not in that environment. So that's why we thought blockchain could come in and complement X-Road. And also for servers that are outside the X-Road environment in the IT system, blockchain can provide security for data stored or that is stationary in those servers. That's why we thought we could extend blockchain outside the X-Road realm.
Okay, I think we're starting to develop a picture here. So is it that in healthcare and in this health system, you may not always be connected to the 5G network? Is that sort of where you kind of implied that, well, we may not be always connected. These devices may have some disconnect time. And so there we can ensure integrity with blockchain. Was that it?
The advantage of blockchain in telehealth systems is that at the moment, health information can also be stored in cloud-based servers, which are also outside the realm of the mobile network. And because the mobile network is providing security also from the transmission system in the core network, but the moment the information gets out of the 5G system, it's now in the cloud and blockchain can play a role in securing the information.
Okay, so all right. I think we're starting to get somewhere with that. Yeah, right. You pointed out that in the X-Road solution, we need to rely on the end-to-end security, that the end device needs to be secure and the end device needs to be trusted, that it won't do something bad with the data or something like that. And typically that's okay in government applications. If governments are talking to governments, we can typically guarantee that. But you feel that in a healthcare environment where an X-Road might be talking to consumer devices or might be talking to different systems, that you need this extra layer of accountability and extra layer of authentication, that the device doesn't mess with the data. Is this something like it?
Yeah, that is correct. That's why we're talking of telehealth or 5G based telehealth systems, because 5G goes outside the realm of even government systems. If we are talking of a Ministry of Health, the 5G networks go outside the government systems into private networks, and X-Road doesn't get into there.
Okay. I could see that where maybe some of the misunderstandings, where people are now trying to get what you're coming from, because most of the time people have thought about X-Road as this European government thing where European governments talk to other European governments, and what you're doing is saying, oh, actually, no, we can use X-Road in these other circumstances, but when you take it outside of governments talking to governments, we need extra layers, extra checks on the transmission and storing of data.
Yeah, that is very correct, because once we get out of the X-Road technology has been working very well in government to government systems, but this is a new application of X-Road, which we thought we could use it like in telehealth systems or even telemedicine systems. it can be used to provide an additional layer of security between distributed digital health databases.
Okay, interesting. How was it? Tell us. You gave in the last few slides of your talk. You talked about the setup of X-Road. You talked about the steps that you needed to take to implement these servers. How was it from a technical side? Did you find it straightforward? Was it difficult technical setup? How was that for you?
Maybe I can leave Sam to comment to
Okay,
that
Sam,
one.
jump in. How do you feel about the technical side of X-Road?
Well, the part that I enjoyed most about working with X-Road is that it has a very well documented process on their GitHub repositories where you could find step by step what you need to do. And we also had some YouTube tutorial videos where we could see what the steps were and what to do with them. We had a few challenges on the way though. So some of the instructions we worked with were for Ubuntu version 16, and we had Ubuntu version 18 installed on our systems, and there were a few details that we missed along the way. So we had quite a bit of a problem working with that, which I believe is something that could be improved going forward, because this is a kind of a new technology that has a potential, has the abilities to make a kind of breakthrough in not only healthcare but in banking and other sectors. So having proper documentation for different operating systems would go a long way to make it more easier to integrate in the future. But be that as it may, we managed to get an instance running both as using the containerization concept and getting it running on individual systems where a system is dedicated as the central server and a system is dedicated as the security server and whatnot.
Okay, good. Well, that's very interesting technical insights. And also, we have heard today that, for example, in Finland, they were trying to address the difficult technical setup issues as well. So this is not something that is isolated to you, and it's certainly something that the X-Road and NICE are aware of and they are working on. So we need to leave it there. Samuel and Bessie, thank you very much for your time today.
Thank you very much for having us.